Okay, guys, we are going to finish up the knee. We're going to do the waddle walk, which is trail guide number 2, and then we're going to do the heels on both sides, which is trail guide number 3. We're going to just demonstrate it a little bit, maybe differently than what it is in the book. Both are great references. It's just a way to do it, not the way to do it. So if you understand where the patella is, you walk yourself down the patellar tendon, find your tibial tuberosity right out from there. So you're going to go medial and lateral with your thumbs. You're going to find your medial and lateral tibial plateau. At that point, if you come back up just even about an inch superior, you're going to find that joint line. Important to understand the joint line, meniscus right in there, lots of attachments from your medial collateral ligament, your lateral collateral ligament, just understanding your joint line. If you come back to the center onto that patellar tendon, go up like a smiley face, you're going to hit on those medial and lateral femoral condyles. So as your femur comes down, forms those condyles, important to understand that as well. If we ride just a little bit on the medial aspects, and Dr. Rovick can just rest her leg out, if we're on the medial epicondyle, we just ride just a little bit superior to that. You're going to find that adductor tubercle right in there, where that attachment site is in there. You can ask your patient to resist adduction, and that should pop up right underneath your hands. You can also ask, and we can understand that we're going to ride onto the pes anterine, usually a tender point on someone in here. So if you find your patella, find your medial joint line, slide down, and as you roll over that medial tuberosity, right underneath of that is a source of all the attachment sites. You should be learning this in anatomy, right? So, but it's oftentimes a tender point for your patient. If you're not quite sure, kind of move your thumb around. And a lot for me coming in that I'm actually cupping the back of the leg and then placing my thumb as I'm kind of coming up and underneath. That's really that tubercle.
Listen to what your patient tells you, because this is similar to other parts of the body that we don't palpate very often, but they are often tender even on patients who don't have anything going on.
Yes, absolutely.